Brought to you by DentalImplantsGuide.com. Best online info.
Okay, this is going to be a presentation on the MIS-7 implant from MIS Implant Technologies. The MIS-7 is a two-stage screw-type implant with an internal hex connection. There are several different innovations with this implant that really make it a better implant and a step above what several of the implants on the market really have. There is a lot to offer with this implant. The implant itself is made out of grade 5 titanium alloy. It's alloyed with aluminum and vanadium, which basically gives it a 25 to 30% stronger biological behavior, which over time will help the implant to last longer. It also helps to fight off corrosiveness, which all metals have. As I mentioned before, the internal hex is the connection on the implant. It is a 2.45 millimeter hex, which is actually compatible with some of the internal hex systems out on the market today. Therefore, by using the MIS system, you have the compatibility with those systems. You do not have to get new instruments. You do not, in some cases, even need new abutments, and you're able to restore the case much easier and from an MIS perspective in a much more cost-effective way. The implant is also a self-tapping implant. Basically what that is saying is that there are 3 blades on the bottom of the implant itself, and as the implant is being placed, they are actually cutting away at the bone and creating the threads for the implant to be able to be placed properly. As it is cutting with those self-cutting threads, there are also 3 bone channels which will gather the bone chips as it's being placed and will help to add to the initial stability of the implant, really giving it superior initial stability to a lot of the implants out there on the market. Another innovation that makes this implant unique is a domed apex. What this basically gives you is when you're working in the sinus area, it will help to prevent perforation of the sinus, and therefore it's really a protective measure that will help you in many different cases. When it comes to the initial stability, other than the self-tapping abilities, which again will gather the bone chips into those 3 bone channels, there are a couple other innovations that will help in both initial stability as well as secondary stability. There are micro rings at the neck of the implant. As a matter of fact, this is an older version of what we have now. The newer version, these micro rings right here, actually go all the way up to the top of the neck of the implant. What these basically do is they give more surface area for the bone to really attach itself and give that initial stability. And in the secondary round, again, it increases that surface area, giving the osteoblasts and the osteoclasts the ability to work themselves into the grooves in more area and more places to really get that secondary stability. The second area of initial stability where our innovations come into play is with the thread thickness. What you'll notice from this diagram is that as you go from the apex of the implant all the way up to the neck, the thickness of the threads is actually increasing. What this does is it actually acts as a bone compression machine. When you're placing the implant, as the implant is being turned, it is compressing the bone, and again, you're getting better initial stability. It's getting a grip into the bone. These threads are probably more aggressive than almost anything out there on the market, and you're really getting a great bite into the bone. Now, the implant shape is a tapered style. What we mean by this is that the body is actually a taper, but if you take a look at the aggressiveness of the threads, what you're basically seeing is that they don't change their pitch, and therefore you're getting, again, a better bite, but it has somewhat of a parallel walled look to it. When it comes to the insertion, there is a school of thought that basically says that because we have a dual thread design, which basically means there are 2 different threads that are running from the apex of the implant all the way up again, when you're placing the implant, it goes in faster, you're generating less heat, and ultimately protecting the bone. Like I said, there's a school of thought that finds this to be very important. That school of thought is usually the one that is placing using the handpiece. At the same time, there's a school of thought that says this makes absolutely no difference at all. And the reason for that is because those are the ones that are usually placing with a wrench, with a hand wrench, and they're usually not generating enough force and enough speed that it really makes a difference that you're not generating that much heat. The microstructure of the implant is obviously extremely important for the biology, extremely important as to your surface attachment when it comes to the second stage, to your secondary stability. The implant itself is large particle blasted and acid etched. What this basically does is it creates both micro and macro pores, as you can see from the diagram here. What that does is it gives the osteoblasts and the osteoclasts the opportunity to really fight their way in and get into these, the micro and the macro pores, and really get down and dirty and do exactly what they need to do to have that osseointegration happen at its maximum area surface area. An innovation that you're going to see from MIS implants on the MIS 7 that you will not find from any other implant company in the world is right here. It's the final drill. Basically, what this is a drill that is specific to the length and diameter of the implant that it comes with. It is right there in the box with the implant, and it is, again, specific to the length and diameter of that implant. And what the advantages of this are, A, is that you know that when you're opening that box that you have a sharp, sterile final drill, that you don't have to wonder how many times it's been used. You don't have to wonder whether it's sharp or whether it's dull. You know it's sharp, you know it's sterile, you know it's ready to go, and you can just finish off the osteotomy and you're ready to place the implant. The other advantage of this is that if you're just trying out the MIS system, you don't need to buy the MIS surgical system right away. What you basically do is you buy the implant and use a surgical system that you currently have. You follow the guidelines that are set aside within the drilling sequence, and you'll basically stop short and you'll use the final drill in types 1 and 2 bone. Because basically, this drill is only indicated for types 1 and 2 bone when you really have that dense, hard bone that you want to prepare the osteotomy perfectly. When you have types 3 and 4 bone, when it's the more spongy bone, you're basically going to underprepare that osteotomy anyway and just use a countersink to open up the cortical layer and then place the implant. But this is an excellent feature, again, to help save you money in investing in that surgical kit when you're not necessarily sure about the system initially. And it's also something that even as you go on and even once you have the surgical system, it will help you out in the fact that you don't have to worry about your drills. Basically, this is a short video that's going to show the placement procedure. Within this video, this is going to be the final drill that's going to be coming down and finishing the preparation of the osteotomy. And you can see it goes right down to this line. This line will go right down to the cortical layer, and then your osteotomy is ready for that implant to be placed. Now you'll see as this implant is being placed, the bone chips are gathering up right now along the sides and in those channels. And then you'll see as you're going, this line here will actually increase in size, which will indicate the condensing of the bone as the implant is being placed, and those wider threads are really coming down and bunching that bone up, so you're really getting that great initial stability. And again, you're going to get a great fit in the bone, and hopefully you will enjoy the implant as much as many of our doctors have. The implant itself comes in 4 different diameters now. It comes in a 3.75, a 4.2, a 5.0, and a 6.0. What is noteworthy at this point to say is that the 3.75 and the 4.2 constitute the standard platform. The 5.0 and the 6.0 constitute the wide platform. Most of these diameters are available in 8, 10, 11 and a half, and 13 millimeters. They're also available in 16 millimeters, but the 6.0 is actually not available in a 16 millimeter size. Again, as you can see about the final drill, you can see that it is specific to the length and diameter of the implants that it's going to be going with.
Brought to you by DentalImplantsGuide.com. Best online info.